I want to talk about what people are getting wrong about masks and the coronavirus. I'll tell you a little bit about myself. Unlike what Noah just said, I'm definitely not an expert in air pollution. I
More or
did.
less, come on.
I I won't claim to be. Maybe over the years, but I did PIA back in 2007. I was in Guangzhou, which I believe that post is no longer in existence, which is a little sad. I got a PhD in social psychology at the University of Virginia. I founded Smart Air while I was on a Fulbright scholarship in Beijing, and I'm now an associate professor at the University of Chicago. I'm at the business school, but I don't really know anything about business. Um, so when I was on the Fulbright scholarship, a couple years after PIA, I founded a social enterprise called Smart Air, and we're dedicated to the idea that air purifiers, that there's just a lot of bullshit information out there that companies try to leverage in order to trick people to pay them more money for purifiers. And then we put out open data and simple purifiers that are a hell of a lot cheaper and very effective. And so our goal is to help people breathe clean air. It's not to make money. And we are very good at not making money. So we host workshops where we teach people about how air purifiers work. We teach them how to make them. We've shipped over 50,000 DIY purifiers to people all over China. Since then, we've expanded to Mongolia, India, Philippines, lots of other places, mostly focused in Asia. But what I want to talk about is how Smart Air has sort of pivoted to deal with the coronavirus and questions that come up from that. And in particular, I want to deal with a popular idea in the United States, which is that masks don't work, or that you need these, fancy N95 masks. So here's just sort of a random person on Twitter saying that surgical masks don't work. Here is not a random person, a doctor on CNN telling you why masks won't help you against the coronavirus. Even the Surgeon General told people they are not effective at capturing the coronavirus. More recently, it's gotten a little bit more nuanced. As you guys have probably noticed, that society's changed a little bit in the US on this. But I still hear things like, yeah, they'll help, but only they primarily keep sick people's viruses in. They don't keep healthy people healthy, which is a bit more nuanced. But I'm going to argue that all of what you have just seen is wrong. But before I do, I want to show you guys just a poll, which is, it's on the Smart Air Twitter. We asked people, which do you think works better, an N95 or surgical mask? And we told people, by the way, this is a randomized study. So hospitals randomize nurses to wear either N95 masks or surgical masks. This is prior to the coronavirus, by the way. They're just measuring flu. And then they tracked how many nurses got the flu. Which do you think worked better? The N95 was overwhelmingly the winner of this poll. But when you look at the actual data of the nurses assigned to wear N95 masks, 8.2% of them got the flu versus 7.2% in the surgical mask group. It's not a significant difference there. Although if anything, it slightly favors the surgical masks. You might say, all right, well, that's one study. Any particular study can be kind of fluky. So who knows? So here's another one. This one was done in Canada. So again, N95 masks, 10.5%, surgical masks, 9.4%. At this point, you might be thinking, hey, I know what's going on here. Maybe both masks are not working, right? Because we don't have a control group. We're just looking at people who wear this mask versus that mask. But both of these are consistent with the idea that maybe masks just don't work at all, right? So if you give people two completely ineffective interventions, and they're not different from each other, well, that didn't prove anything, right? So what we would really need is we'd need to find some place where we could randomly assign people to get exposed to a disease, and we would randomly assign them to not protect themselves. That seems unethical, right? Like, how are we gonna do that, right? Well, where could we do that? Well, researchers thought about this question. They thought, we do that all the time at home. So what they did is they took families who were taking care of a child, their own child, who had the flu, and they randomly assigned the parents to wear masks or not at home. And they considered this ethical because the standard is people don't wear masks, even when somebody is sick at home. This study was done in Australia. So here's the citation. So what they found is that among the parents that were assigned to wear no mask, 16% of them got sick, which, by the way, is pretty low. I mean, it's not even half. So that's pretty interesting. Although we have a vaccination for the flu. Among people assigned to wear surgical masks, 8% got sick, and then N95, another 8%. So again, no difference there. Now, one thing I will say is that a fair number of parents just didn't wear the masks. They were asked to wear the mask, but they found them uncomfortable and just stopped wearing them. For not surprisingly, for parents who don't wear masks, they don't work. So not a shocker there, but among the parents who actually wore the masks, they did work. More recently, people have been talking about, okay, maybe masks work, but what about DIY masks? Fortunately, there's been some really cool research on this as well. So researchers tested homemade cloth masks. They just had participants make their own cloth masks. And then they shot, for example, bacteria particles, like the ones I'm showing you here. They shot these particles at the masks, and they said, what percentage of these very small particles will the masks capture? What they found is that even just simple cloth masks captured almost 70% of these very small particles. These are on the size of the entities that cause anthrax or the plague. Now, not as good as a surgical mask. Nobody's out here saying a DIY mask is as good as a surgical mask, but a hell of a lot better than nothing. They also looked at even smaller particles. These are a bacteriophage. 0.02 microns of very, very small particles, even smaller than the coronavirus. The percentage there was a bit lower, but about half of the particles. So again, a heck of a lot better than nothing. Now, you might ask yourself, well, okay, maybe these things can filter out very small particles, but what if somebody's actually wearing the mask? I mean, these things don't fit very tightly. There's probably a lot of leakage going on, so maybe they don't actually work in practice. Well, researchers have tested that too, doing what you see in this picture here is called a fit test. And I've actually done one of these tests too. Here's a picture of me doing that test. And what it does is they use a tube to sample the air inside the mask while somebody's actually wearing it. So you actually can tell how much particulate is being filtered while somebody is wearing the mask. And then you can compare that to the air just outside the mask. So when researchers did that with these homemade masks, what they found was they were filtering 60% of the particles, which again is not as good as a surgical mask or an N95 mask, but again, a heck of a lot better than nothing. Finally, researchers have looked at, okay, if DIY masks really work, are some materials better than others? What they found when they looked at filtration effectiveness, you find some materials work quite well. So you've got like a vacuum bag here, vacuum cleaner bag, 95% of particles, dish towel, 83%. But even t-shirts and pillowcases doing quite well at over 50%. People have wondered, well, maybe if I double up the layers, will that help a lot? And what they find is actually probably less than you'd think. So like a double layer t-shirt only improved the efficacy by about 1 to 2%. So maybe not a terrible idea, but it doesn't, for example, double the effectiveness, which you might think. So those researchers recommended the pillowcase and the cotton t-shirt. The reason they didn't recommend some of those things that filtered even better is because if you look at breathability, it's hard as hell to breathe through a vacuum cleaner bag. It's a great filter, but it's a terrible mask. And instead, for example, the t-shirt and the pillowcase did a decent job at filtering particles and are actually easier to breathe through than masks. So the researchers recommended those. So they recommended, again, pillowcases and cotton t-shirts, if you're curious. Smart Air, we've published our own tests more recently. We've tested even more materials than they have. These are some of the ones that we recommend. We have a full blog post about that if you're interested. So bottom line, things that I hope that you remember when you, I was going to say go home, but you're probably already at home. One is that masks capture even free floating virus particles. So even when they're in their smallest form, masks can capture a decent percentage of them. DIY masks capture those, even accounting for fit. Surgical masks and N95 masks lower infection rates, and it's not just to keep sick people from infecting others. They actually protect healthy people. I think that's important to know. And that's true even in studies when they don't fit test people, so they just give the masks to people, they don't actually fit test them. Even when they're worn by non-professionals, so like the parents in the Australian study, and even when they're not those gold standard N95 masks. So I think that's all important to know. What we don't know is there's really no evidence that DIY masks prevent infections in the real world. When I say there's no evidence, that's because nobody's tested it. We know that they capture viruses, but we don't know whether they actually prevent infections in the real world. So hopefully somebody can do a study of that. We don't know how big of a threat reusing or touching masks is. Nobody's really studied that in sort of a real world context. And we also don't know how much of the effect is because these masks are filtering out viruses versus preventing people from touching their nose or their mouth. There's been a lot of speculation about that recently. Other people have speculated maybe masks help in part because they're a behavioral signal. They sort of signal to other people like, hey, don't come near me, or hey, I care about the virus, or hey, we should be apart from each other. So that as a psychologist, I find that one particularly interesting. So anyway, I hope everybody is well. If you're interested in smart air, you can follow us on Twitter, Facebook.